Hello, good morning, and what's good, you beautiful people of Atlanta's Westside. Welcome to the 30th, gosh.
30th.
Virtual Transform Westside Summit. My name is Benjamin Early, and I'm joined by my lovely co-host.
I am Ebony Ford. Good morning, 30th.
I know 30th is.
We made it, we in there.
Look, we're trying to make it.
Yes, absolutely.
And speaking of trying to make it, we're broadcasting live this morning from the Sullivan National Center for Primary Care here at Morehouse School of Medicine. Special shout out and special thank you to President and Dean Dr. Montgomery Rice. Thank you so much for having us and inviting us to come and host the show here on campus. It's a lovely campus, and we got a great show ahead of us, talking all about COVID-19 and the Delta variant. We're going to hear one of the foremost experts here in the city, Dr. Emma Gluck. We're going to have her on stage to talk all about the Delta variant and give all the information on the facts versus myths so that we can all be informed and make informed decisions to help stop the spread of COVID-19.
Absolutely.
And Ebony, I know you got the bulletin and stuff.
I do. I don't have the printout today, but it's okay. Because, of course, on our website, westsidefuturefund.org, you can get your PDF version of our bulletin today. We will also be hearing from the Good Samaritan Health Center, which we want to give them a special shout out.
Absolutely.
Because a part of our protocol to come here and be allowed to broadcast in this beautiful space today was that we had to get a negative COVID vaccine test,
right,
which was given to us so graciously by Good Samaritan. So we will hear from Mr. John Allison today. He's going to be doing our devotion.
Right.
And so we are all vaccinated. We all have a negative test within the last couple of days, and we still are 6 or 7 feet apart. So we want to make that known, and we're wearing our masks.
And we masked up.
So we're doing good.
Absolutely.
We're doing good.
And a special acknowledgement. I mean, the first virtual summit that we ever had, we broadcasted live from Good Samaritan.
Absolutely.
So shout out to Good Samaritan Health Center. We appreciate you and all the work that you're doing to serve the Westside community. Continue the great work. We look forward to continue to move forward with you.
And speaking of serving the Westside community, for those of us who are not familiar with Westside Future Fund, what we do here, our mission is to try to create a community that Dr. King would be proud to call home. And so that's what we're out here doing on the streets every single day, making it happen. And our board of directors are the main reason that we're able to get this awesome work done. It would not be possible with all of these dedicated individuals. So again, we want to thank our board of directors. And I also want to make sure that everyone knows this is an all-volunteer board. This is a passionate group of Atlanta leaders who are committed to our vision. And so we're, again, very grateful to them. And also, none of the work would be possible without our direct Westside Future Fund team, a couple of them who are here helping out today with the summit, and that's them, and we are very happy to have them working with us.
And that being said, it's time for us to get connected. We are on Facebook, we're on Instagram, Twitter, YouTube. Be sure to like and subscribe to all of our channels. Be sure to share information such as the summit that's broadcasting today. If you like the information that you're going to be hearing, which I guarantee you will because it's very helpful, please help us share this information. Not only will it spread the word about what Westside Future Fund is doing to help, empower the citizens and residents of Atlanta's historic Westside, but it's also helping to spread the word about how we can actually take step by step to stop the COVID-19 and all of its variants in their tracks. We've been at this virtual thing for a minute now, and it's not just for fun. Yes, we love it, but it's also because it's dangerous out here, folks.
It is.
It's dangerous out here.
It is.
So we want to, very seriously though, we want to do what we can to contribute to stopping the spread because, we've all either been touched directly or know somebody who has been touched by COVID-19, and that's an ugly side to this whole pandemic that we're going through right now. So the only way that we can stop it is if everybody does their or enough people do their due diligence and do what it takes to stop the spread.
Absolutely, absolutely. Yeah. And before it's too late, I want to make sure that I mention we do have 2 very important partners working with us on the West Side, Home Depot and the Goodwill of North Georgia, and they are both also giving something away today. And you can register to get a gift card by going to westsidefuturefund.org, clicking on Event Spotlight, clicking on the RSVP button, and entering your information by 8:15 for, again, a free gift card from Home Depot and the Goodwill of North Georgia.
And shout out to both of those organizations.
Absolutely.
They do fantastic work.
Yes, they do.
Not just on the West Side, but throughout the city of Atlanta. So thank you to both of you. And for those of you who are used to joining us, we know you're used to seeing President and CEO of Westside Future Fund, John Nauman, up here with us today. Unfortunately, he wasn't able to join us today, but we look forward to having the big man on campus
Back
at the next summit, which will be September 17th. So we're going to be skipping September 3rd, and we'll be back on September 17th.
Yeah,
so
everybody enjoy their Labor Day. Enjoy their Labor Day.
Absolutely. So that being said, let's get into our devotion. You know, it's become our tradition here at the summits to begin our meetings with a positive, inspirational message from a member of our community. Absolutely. Recognizing that many in our community are driven by their spiritual faith to participate in the Westside revitalization effort, the time at the beginning of our meetings is an opportunity to share various inspirational reflections. While the speakers may articulate their personal faith, it's meant to be inclusive, inspiring, and meaningful with the story of Nehemiah as our guide. Enjoy Mr. John Allison, Director of Marketing and Communications at Good Samaritan Health Center, his devotion.
When I was homeless on the streets, I was thinking about surviving. And that's what makes this program so special, is that they care for you when you don't even care for yourself. The one drug and one drink brought me to 15 years of using and drinking and prostituting. I didn't have no control over it anymore, and I was homeless at the time. It was a really, really bad, dark place that I lived for 15 years. One day, I was introduced to Good Sam. I came here every Friday. I was still homeless at the time, and I didn't have health care, and I didn't have health insurance. A guy threw a brick at me when I was sleeping on the side of the street. I came here, and they were very supportive for me. In November, I'll be 17 years of clean and sober. It's helped me to learn to love myself, but to love other people first. If you're homeless and you don't have a place to go for your dental or for your medical or for counseling, you can come here. Even if you don't have any money or you don't have any income, they will help you in spite of what you don't have. The people that they have the team. I call it the A-team because they're awesome. They're an awesome team together. This is a blessed place of God. And each person gets the blessing. Everybody gets the blessing, from the clients to the employees to the people on top who runs this. This is like a safe haven.
Good morning, everybody. My name is John Allison. I'm coming to you from the Good Samaritan Health Center on this Friday morning, and I'm thrilled to be a part of the virtual Westside Future Fund Summit today. And I would just like to pay homage to the people who have gone before me, who have offered the devotions. I've been privileged to be a part of many of our Friday gatherings, and I never cease to be amazed at the impact and the insight that people offer, particularly on the book of Nehemiah, and how that correlates to the work that's going on the West Side here in the Atlanta community. So I'm grateful, and I was contemplating what more could be said or offered in terms of great perspective from the position of the book of Nehemiah. So with that, I'm going to do my very best to offer, over the next 3 hours, just kidding, John, I'm going to do my very best just to offer a humble insight for you all this morning. And with that, let's get started. When I think of the book of Nehemiah, if I could go into the vernacular or rename the book of Nehemiah, not that it needs renaming, I might want to call it Nehemiah the Collective. Because when you look at the book of Nehemiah, the undertaking that took place in the revitalization, the rebuilding of the wall, it wasn't gentrification, it was revitalizing an existing community. And never with the intent to displace residents, but to create a renaissance of life for those who lived in that community. So with that, when I look at the book of Nehemiah, I think in terms of the collective effort it took to do a mammoth undertaking in rebuilding the wall. And when I'm looking at the wall, I wanted to just give you a few statistics about what we understood about the wall that Nehemiah championed and led the construction of. It was about 2.5 miles in length, with an average height of 39 feet. and an average thickness of 8 feet 2 inches, and adorning the wall were 34 watchtowers and 8 gates. Now here's a phenomenal thing to keep in mind. That monumental building that took place was accomplished in just 52 days. When you look at that accomplishment, it seems, and it truly was superhuman. It took the intervention of a divine entity, and we believe that was God. And we believe that Nehemiah was unctioned by God, inspired by God, empowered by God to lead the endeavor. And here's the thing, although Nehemiah bears the banner above the book, it really was the collective that accomplished such a phenomenal feat in 52 days. It was a concert of humanity coming together, divinely inspired. And that inspiration came at a cost. There was incredible resistance. But if you look in the book of Nehemiah chapter 3, it's a litany of the assignments of who did what in respect to what portion of the wall. So there was a vast majority of people that were laying their hands to the rebuilding of that wall. Some worked more fervently and diligently, some attended smaller sections, but nonetheless, it was a collective that did the work. And that collective that did the work had each other's back. There were countless times where in the building out of that wall, that people were challenged by naysayers, by critics, by antagonists to the work that was being done. And there are pictures in that moment of time where they're building the wall where while some were working, others were guarding the back of the workers to protect them in their work. So albeit Nehemiah is the badge and the namesake of the book and is a big central figure in the narrative, the larger scope is the work of the collective that was employing every aspect they had, everything at their disposal and power to undertake this amazing building of the wall. And here's a part of the book that I want to pull out for us. And I believe I've even heard it stated in previous devotions here on these Friday gatherings. It comes from chapter 4, verse 6. And it says, "So we built the wall till all of it reached half its height." And here's the point to drill into. "For the people worked with all their heart." The collaboration of people who worked were doing so, they were doing it out of passion, out of love of community, out of a great sense of purpose. And albeit Nehemiah was a person of faith, faith was centric to the work that was being done. He did have a strategy, he did have a plan, and he did have a way to mobilize the collective to accomplish this work. Let me just remind again, 52 days it took them to accomplish this phenomenal feat. And if you remember back to the statistics of the wall, it was on a scale it's pretty impressive. When I think about what was transpiring in those moments, I think one thing is absolutely true in any noble endeavor, that no matter how fortified we are in that work, no matter how accomplished, no matter how much we have in terms of reserve and resources, there will always be moments that as we work together as a collective, that fatigue sets in, discouragement sets in, where we kind of scratch our heads and think, I'm exhausted. I don't know if I could go on one more day. And just because we're doing noble work, it doesn't mean it doesn't go unchallenged. And some of those challenges come in the most unexpected ways. And by folks that you think might be cheering you on, somehow they become antithetical to what's going on. And it's in those times that the collective has to draw together and protect each other. Because there are times where one element of the collective is working strongly and the other one is needing to take a respite. And in that case, the collective surrounds that weaker person or that weaker entity and imbues them with their own strength. In other words, they become the shoulder that they can lead on to keep full attention on the task at hand. When I think of all the variables that can take place when we're doing amazing work, particularly on the west side of Atlanta, and the collection of people, the organizations that have come together, the individuals that have come together, it's without question the power of people living in community that is allowing the task to move forward, that is preserving the energy that's needed to finish this task. I was on the Westside Future Fund's website, and one phrase that I pulled out of there that really impacted me, it says, "As the Westside Future Fund looks to foster the holistic transformation of the Westside's 4 historic neighborhoods, it will take the support of all Atlantans, working together to make that happen, the collective. And one of the things when we work as a collective, that models what took place in the rebuilding of the wall that Nehemiah oversaw was the 34 watchtowers, the 8 gates, there are specific locations. And much that way, that when you think of the collective that's working together, for instance, the Good Samaritan Health Center holds a position on the wall of healthcare, in the healthcare space. We exist to serve folks who are in need, who do not have the means through traditional insurances or resources to pay for their medical needs or dental needs, mental health needs. So we work on a specific position on that wall. And like Good Samaritan, there are others who work on financial wall gates. They work in social justice aspects of the wall. They work in housing aspects of the wall. This collective is working in harmony and in concert with each other to accomplish the objective. And it's going to take everyone working. That when those things are transpiring, I think one of the things that sometimes we don't feel the liberty to do is express the vulnerability of just how demanding the challenge could be, just like in the days of Nehemiah, when other members of the collective had to have the back of the people behind them. They had to have that sense that I can lean into other members of the collective. So I ask those who are watching today that are responsible for holding a position on the wall, if you're tired, if you're feeling the fatigue, if you're feeling the grind of doing good, that you not bear that you not isolate, that you not, and we not disguise the weakness, because when we make ourselves vulnerable to our team, you increase the opportunity for that team member to come and bolster your work. So with that, I wanted to kind of summarize everything I've shared with you, and I want to harken back to one of the great prophets of our time and one of the writings. Of course, I speak of Bill Withers. In 1972, he penned a great song, and I'm sure if I began singing it, I wouldn't want to call attention to any copyright matters or have to pay any fees, so I won't sing it, and probably good that I don't. But I want to quote this song because I think it really encapsulates the nature of what it means to be a collective, to be doing good work, to understand that there are times we have to call out, and I dare say cry out, because, hey, I'm doing good work here, but I need some assistance. I need strength of a brother or a sister or a community. Bill Withers penned this in the 70s, and he wrote it during a time when he had left his hometown of Slab Fork, West Virginia, and was living in Los Angeles. During that time, he became despondent, and he was mourning the loss of the strong community effort that he had experienced living in a very impoverished situation in this community in West Virginia. So he purchased an inexpensive piano, and he said he ran his fingers across the keys of this piano, and he contemplated the hook of the song, which is "Lean on Me," and it just came out of him. So when we think about the collective, when we think about the book of Nehemiah demonstrating the power of humanity coming together, inspired by God, inspired by a great leader who's doing difficult work, who accomplished a phenomenal task in just 52 days, I submit to you the collective succeeded because they learned how to lean into each other. Sometimes in our lives, we all have pain. We all have sorrow. But if we are wise, we know there always is tomorrow. And lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm going to need somebody to lean on. Please, swallow your pride. If I have things you need to borrow, for no one can fill those of your needs that you won't let show. You just call on me, brother, sister, organization, when you need a hand, and we all need somebody to lean on. I just might have a problem that you'll understand. We all need somebody to lean on. And lean on me when you're not strong, and I'll be your friend. I'll help you carry on. For it won't be long till I'm going to need somebody to lean on. If there is a load you have to bear that you can't carry, I'm right up the road. I'll share your load if you just call on me. Members of the collective that are working diligently in the west side of Atlanta, we need each other in ways that they're involve being tethered to each other. And as this song has said, we might find ourselves working on a portion of the wall, and we need the strength of a fellow collective member I really hope that we learn the power of being vulnerable with each other as we work in integrity and humility and purpose to accomplish a phenomenal undertaking to see the revitalization, which is taking place, of the community known as the historic West Side of Atlanta. And we do it in such a way that we do not displace, but we regenerate for those who call this part of Atlanta home. Thank you so much, and I truly ask God's blessing on each one of us who are working so diligently in this endeavor.
Wow, John Allison, thank you so much. I want to key in on something that he said toward the end. We do not displace, we regenerate. That is the epitome of what Westside Future Fund is about. You can learn more about our Home on the Westside program and other programs that we offer to help residents of the historic Westside as it continues to be revitalized and continues to see change. And you know, it's organizations like Good Samaritan Health Center and prestigious institutions like Morehouse and Morehouse School of Medicine that are stepping up to the plate in terms of creating equity for historic Westside residents. Good Samaritan Health Center, you know, they prioritize residents from the 30314, 30318 zip codes. And anybody who is from the Westside and any person of color can tell you emphatically that whenever there is an issue going on, a public health issue, an economic issue, whatever the issue is, people of color tend to get the brunt of whatever the impact that's being had. And we often tend to suffer from it, you know, the most and the hardest. And, you know, anybody that's from the West Side can attest to how, you know, there have been racial disparities, economic disparities in terms of who is being able to benefit from the healthcare system throughout the pandemic, and, you know, a whole host of other things that become problems when, you know, you grow up in underserved communities. And so it's organizations, again, like Good Sam, prestigious institutions like Morehouse and Morehouse School of Medicine that are helping to sort of, you know, straighten the path as far as creating equity for residents of the West Side. That being said, it's time for our social check-in. Again, we are on Facebook, Twitter, Instagram, and YouTube. Be sure to like and subscribe to all of our channels. And go ahead and drop a good morning in the comments. Let us know that you're tuning in and that you're happy to see us. It's Friday morning. The week is just about over. We've almost made it. So go ahead and drop a comment, a like, a heart, a share, just to show your gratitude for making it to another day when so many people have not. And so, you know, that being said, again, we have a lot of information here ahead of us that we're looking forward to sharing with you. Before that, I want to share this PSA that Morehouse School of Medicine put out earlier this year on their YouTube channel. You can go there to access it as well. But take a look at this video here.
For nearing a year, the novel coronavirus has taken away our loved ones, co-workers, colleagues, friends, and family. It has taken out thousands of businesses and millions of jobs in its wake. But now there is something very real that you can do to fight back.
For me, for you, for us.
For me, for you, and for us.
It is for me, it's for you, it's for us.
Dr. Kismikia Corbett, a black female virologist with the NIH, helped to develop the Moderna COVID-19 vaccine. So do your part. Roll up your sleeve and get vaccinated. And if it's not quite your time, consider participating in a clinical trial. For me, for you, for all of us, it matters.
This message from the Morehouse School of Medicine.
Again, special thank you and shout out to Dr. Montgomery Rice. Thank you again for having us here at your wonderful facilities. And if you notice, we had the late, great Hank Aaron also featured in that video, one of the greatest baseball players ever to exist. Thank you again to Morehouse School of Medicine. And now, as we prepare to bring up our featured guest for this morning, let me give you a little bit of her background. When I tell you she is the foremost expert in just about any room that she walks in when it comes to virology, viruses, and vaccines, that is not an overstatement. Dr. Lily Immergluck, she currently serves as Morehouse School of Medicine's site principal investigator for its participation in COVID-19 Prevention Network. She is a practicing general pediatrician, pediatric infectious disease specialist, popular health service researcher, and serves on the executive board for the section on infectious diseases for the American Academy of Pediatrics. Currently, she is professor in the Department of Microbiology, Biochemistry, Immunology, and director of the Pediatric Clinical and Translational Research Unit of Morehouse's Clinical Research Center. She also holds an adjunct appointment as associate professor at Emory University's Rollins School of Public Health, and she spent over 20 years studying antibiotic-resistant bacterial infections and vaccine-preventable conditions. Please help me in joining and welcoming Dr. Emma Gluck. Thank you so much for joining me this morning. We appreciate you.
Thank you so much for
Absolutely.
having me.
How are you feeling this morning?
Good. How are you?
All right. Well, we see you got your doctor's best on this morning. You know, you've come prepared to serve our community with some valuable information. So I want to get right into it. Is the media and is the hype about COVID-19, is it just hype? Are we, being led astray as far as, thinking that it's more than what it is? Just help us with the facts on that.
So the fact that you and I are wearing this,
right,
even though we're 6 feet apart, should tell us that this is not a hype. If you look at what's happening in our Grady hospital system, you can see that this is not a hype. Yesterday, the chief of staff, Dr. Jansen, made a press conference letting the community know that we are in a surge. Not only Grady, but all the area hospitals are full, including our pediatric hospitals. We get a daily report about what's happening at Grady, and yesterday's census showed that there are 116 people in the hospital, over 20 that are in the ICU from COVID infections. That is, a record high number. So this is not a hype.
And in your expert opinion, when, I know that's pretty much the pressing question that everybody has, and obviously that changes depending on what the circumstances are, how many people are vaccinated, but on the trajectory that we're currently on, if you could put a time mark on it, when could you best, estimate that we might be either coming out of the pandemic or totally through with it?
So if I had a crystal ball, maybe I could do that. I don't. So we have to use the data that we have from our surveillance, from our public health infrastructure to help guide us, as well as the science that's coming out. What matters and brings us clear as far as when that surge is over depends a lot about what we do as an individual, as a community. Currently, we have to wear our masks in public situations, even if we're vaccinated. That may change if we all do our part. Other aspects are really important is vaccinations. I often give a talk and I end it by saying vaccines don't save lives, vaccinations do. And that's because that is truly what it is. You have to get the vaccination. And we have to now look at who's not getting the vaccines. It's our vulnerable populations. It's our communities of color still. I look at Georgia compared to some of the other states, and we still have a huge number of counties that don't have vaccination rates that I would like to see. And 22% of our population are children. Right now, if you are a child, unless you're over 12, you're not even eligible to get a vaccine. And so that's partly why we see our pediatric hospitals full of kids who have COVID infections. So all of those things matter as far as determining our own destiny as to when we are going to be at the end of this surge and end of this pandemic.
Yeah, and as you mentioned, we mentioned earlier, everybody here is fully vaccinated. And one of the latest statistics that I saw recently about vaccines is that over 99.5% of people who die from COVID-19 are people who are unvaccinated. I believe it was 97% of people who wind up hospitalized with COVID-19 are unvaccinated. When you have the vaccine, you have, I believe, a 0.004% chance of contracting COVID-19 and an even smaller chance of dying from it. So, as we speak about vaccines, can you talk a bit about, the benefit of being able to articulate how the vaccines help people, why we should be able to overcome whatever fears or, predispositions that we have regarding them, why that's important?
Yes, so I'm a pediatrician, and so I have spent, more than 2.5 decades vaccinating children. And I give the talk to medical students every year, multiple times. And I ask them about certain diseases that they should learn about that affect children. And they haven't seen those cases in the hospital or in their clinics, partly because we're doing such a good job vaccinating those kids against those germs. And therefore, we just don't see them anymore. So that's the importance of vaccinations in general. I think that, people ask me, well, why should I get the vaccine if I had COVID? The reason is because vaccinations really help our body to see a piece of the germ that's causing COVID infections. And so even though you got natural infection, maybe because you contracted it on your own exposure, that immunity or your antibody response to that is going to go down with time. Whereas the vaccine is structured so that we can generate a really good antibody, and it looks like against the variants that we see in our community still. Vaccines are not 100% effective. None of them are built that way. But they are 100% effective in the sense of likely to prevent you from dying, okay? And so for me, I got my vaccine back in December, January. I am waiting for September 20th because that's the day they say that we are allowed to have a booster if we want to, if we are 8 months out of our second dose. And that's because we are starting to follow the data and see, when we might need a booster. My daughter had COVID back in March. She got a vaccine, Moderna, in March 1 year later. So when the pandemic started, she was coming home from school, she contracted COVID. She actually had long haul syndrome. And so, I had to kind of live that as a parent. So that was, it's been hard for us because she lost her sense of taste and smell for over 6 months and still has bouts of fatigue intermittently. So anyway, I cannot emphasize the importance again about vaccinations and not letting, just natural immunity by putting yourself at risk to get disease. And then my last point on this is the fact that this is a novel coronavirus. That means it's a coronavirus that we haven't seen in humans before. So we're starting to continue to understand about the implications of having an infection. We still don't understand it. A year ago, I gave talks and I didn't talk too much about long haul syndrome. Now when I talk about it, I try to talk more about what we know about it. We don't know what's going to happen 10, 20, 30 years from now if you contract this coronavirus. So the best way to prevent that and not be that part of your story is to get vaccinated.
Right. And you hinted at, breakthrough infections. So I want to come back to, but the point that you just made about long haul, or I believe it's also called post-COVID syndrome, where you have the symptoms that you might have had while you actually had the infection, at its peak. Like you said, months, possibly even years after you've been infected. Can you talk a little bit more about why it's important for people to consider that in terms of weighing whether or not to get vaccinated for the ones who are on the fence? Because again, it's not just about preventing you from dying from it. Dying is a long way away from being sick for a long time. Like nobody wants to live their life in a condition that prohibits them from going out and living the way that they want to. And the threat of post-COVID syndrome or long haul syndrome is very real. So if you could just emphasize that a bit more as far as why people should go ahead and take that step to get vaccinated.
Sure. I'm going to first, before I go into that, I want to mention another condition that affects predominantly children. It's called MISC syndrome. You guys might have heard of it. It's multi-inflammatory. It attacks multiple organs. That's why it's called multi-inflammatory. Because the heart, the lungs, the kidney, these are organs in our body that have the receptor that the virus can latch onto. We know there's a condition that predominantly affects kids, and in this country, we have already seen over 4,400 kids with this, some of them who have died. The scenario is that usually these kids get their infection from COVID, get over it, they seem to appear fine, and then 4 to 6 weeks later, they start to have some symptoms of fever, a rash, other symptoms that suggest that something else is going on. But look, it's been 4 to 6 weeks after they had their initial COVID infection. The ramifications of that are still, we're we're still discovering and understanding as we watch and follow these children. Going back to the long haul syndrome, we don't quite know. We're following people who have symptoms. A lot of them have fatigue, similar to like a chronic fatigue syndrome. Others have other issues with their memory. Again, I mentioned the loss of the smell or taste. But again, we're only in this 2 years, right? So we are going to continue to follow people who suffer from these conditions. Who gets it? I'm not sure. You know, that's all to be determined. You know, my daughter is healthy. She's a student athlete. She, didn't have any health problems. She doesn't have any of the comorbidities. That's why when we think about, why do we want to get vaccinated? I think that people should understand there are some long-term consequences beyond just maybe, an asymptomatic infection or a mild acute infection that we need to factor in.
Yeah. And speaking of breakthrough infections, and I'll let you define that further, but breakthrough infections essentially are, when you've been vaccinated fully and you still manage to contract the disease, that's typically a breakthrough infection. But something of note is that even if you are vaccinated and you contract the disease, you could still contract it and be asymptomatic. So you don't know that you're infected, and you can still possibly spread that infection to other people who are vaccinated or unvaccinated. And so before we go into this, I do want to emphasize that, this is the point where people start wondering, like, well, what's the point of any of it then? The point is, science is a process. Science is not we start here and the next day we have the 100% answer to whatever the issue is. It is a process that takes a lot of people contributing over time to an unfolding solution. And so we're seeing that play out in real time as far as the efficacies of the vaccines, increasing over time, as well as discovering new conditions and new potential shortcomings of any vaccines that we have today. But all of that is normal. All of that is a part of the scientific process to coming to a final solution where we can one day actually be through with the pandemic altogether. So that being said, speak a bit about breakthrough infections and how often people who are vaccinated should continue to get tested.
So just so that I want to give the right background, breakthrough infections are defined as if you have been vaccinated and you have evidence that you mounted a good antibody response. But if you're not challenged, your antibody response may wane or start to go down over time. This is not anything new. We know this happens with other vaccines. So it's not something like, this is just happening with the COVID-19 vaccines. We see that with pertussis vaccine, where we had some pertussis outbreaks in the past because really within 2 years after you get a booster from the pertussis, which is whooping cough, your immunity starts to wane, okay? So if you get exposed to pertussis, you might have a mild cough. You wouldn't have the whole whooping cough because you're still having an immunological memory that helps you keep everything in check. That's the same thing that's happening if you have a breakthrough infection with a COVID vaccine. We think that people with COVID vaccinations, their immunity, based on what we can measure right now, which is what we call neutralizing antibodies, that 8 months after your second dose, we think it's worthwhile to get a booster. That's why the guidelines came up that September 20th, we're going to start offering the booster to every American who wants one and who is eligible for one. The reality is that if you get the booster, you're going to prevent yourself from getting more serious or more severe disease. How will we behave if we didn't get the booster? I believe that our antibody response or our immune response are still going to be somewhat protective, but we're just not sure to what extent. Gotcha. Similarly, if you're vaccinated and you get exposed to COVID, your ability to clear that infection is much better than somebody who's not vaccinated. Your ability to harbor and get rid of it fast enough so even though you're still maybe infectious to other people, that time period is going to be shorter than somebody who's not vaccinated, if that makes sense.
Yes. Follow-up question, what impact would, say, an FDA approval for a vaccine have as far as, convincing people? Is there any data that suggests that, once you get FDA approval, it has an impact on getting more people vaccinated?
So first of all, the 3 vaccines currently, Moderna, Pfizer, and the Johnson & Johnson, it is FDA approved for use in emergency authorization process, okay? We are in a public health crisis. This is an emergency use reason. So it is FDA approved for that purpose. What I think you're talking about is like once we get FDA approval for EUA, emergency use authorization, the next step is to get it for full licensure so that it's kind of met through all of the normal processes that are needed for vaccines to be used without concern. So that point, I think people are waiting for that partly so that they can maybe more easily mandate that in the maybe different workplace settings or educational settings. But to me, we're in a public health crisis. Every day people are getting sick. Every day people are dying. So we should all take the vaccination because that's going to help get us lower in terms of that community transmission level.
And before we move into this next segment, I want to get into, a teaser about the Delta variant because that's what's largely going on here. And so we'll come back to this later as well. But if you could just speak to the difference between the COVID-19 from, say, early 2020 to the Delta variant, which has been sort of running rampant lately.
Yeah, so first of all, Delta variant, Alpha variant, Beta variant, they're all coronaviruses. They've been mutating. So fundamentally, people have to understand that, first of all, coronaviruses have been around a long time. We have other coronaviruses that have been, where humans have been exposed. It's just that this one, prior to 2019, humans had never seen before. But they have the same blueprint as a coronavirus. And like many viruses, viruses mutate. That's just the way they survive. They just adapt to the environment, their situation, and they mutate. So every few weeks they can mutate. We continually see mutations. That's not surprising. It's what's surprising, what's hitting the media is the fact that some of the variants have certain mutations that are very concerning. Like Delta variant, for example, compared to the original variant that came out, is much more transmissible. It attaches more easily and replicates a lot faster. And so the replication time for it to multiply for somebody who got it is like more than twice as fast. And so for that reason, that's why we have to do this even though we're both vaccinated. But again, we have to keep an eye on the different mutations that are occurring and follow them and see how much it's affecting our population. So if you think about it, I gave a talk maybe several months ago, and at that time the Alpha variant was the dominant variant in the US. Now, more than 98% of the variants that are being sequenced in the US is the Delta variant.
Wow. Well, moving on to the next segment, I want to show a video that Morehouse School of Medicine helped put out using Salesforce technology in the launch of the National COVID-19 Resiliency Network. Let's cue that video.
The Morehouse School of Medicine is one of the 4 HBCU, historically black colleges and university medical schools in the nation. It's the youngest of the 4. It was formed in 1975 on the campus of Morehouse College. But we were created to lead the creation and advancement of health equity, working with communities of color, and as well as training students. We're also a research institution. When COVID-19 hit, of course, we provide health care to the community. The patients were at risk, but also we did the studies to show that COVID-19 was impacting Georgia and disproportionately impacting the communities of color, especially the African American community. We were already suffering in these communities with the high incidence of chronic diseases such as diabetes and hypertension. And then when COVID hit, that was a greater impact on communities who also have less access to care. And therefore, we had this opportunity to apply for this funding with OMH to develop the National COVID-19 Resiliency Network. We have a great working relationship and gotten to the place now we are developing something that's going to be impactful. But KPMG has been a good partner to work with, accommodating, really understood the model.
We have a mutual understanding of what the mission of Morehouse School of Medicine is. And I think by having that understanding, we were looked at as a partner who could come to the table and hit the ground running.
What's unique about our work with Morehouse is that we're applying advanced technologies in data and analytics to target both the populations and pair them with the services and the supports that they need. Traditional approaches to this type of thing have relied on funneling money into community-based organizations and others that have access and reach into the community. And while that's a key component of the Morehouse strategy, the technology and data and analytics is what sets it apart.
KPMG was very uniquely positioned based on our extensive research over 5 years developing the Signals Repository. What the Signals Repository is, it's a database made up of various data points that we're getting from CDC, public health agencies, academic centers, where we're bringing all of this rich information in together, where we can bring that to Morehouse School of Medicine.
I think it's really important that you think about Salesforce and KPMG. It's two world-class companies with world-class resources at our fingertips, and we were able to leverage all of those resources to build this solution. So when you think about the Morehouse data and you think about the project, what we were able to do through working with KPMG was analyze all that data and put it in a format in which people could make better informed decisions.
One of the main components is a user-facing portal that allows underserved communities to have access to a flexible, easy-to-use platform to get access to information, to being able to connect with resources around them locally, but also being able to connect with community-based organizations that can help them in these difficult times. The second component, of course, is a program management piece within the Salesforce platform that Morehouse School of Medicine and the community-based organizations can use to manage interactions. The third piece is a communication platform, and this is where we're able to drive targeted communication, responding to their questions, and really helping them connect to services that matter.
But also, as we think about going forward, we know that some of these populations may not have access to a local healthcare provider. We know that some of these populations don't have access to a CVS or a Walgreens. So we're looking at embedding telehealth capabilities into this platform. How do we do outreach to these populations that, again, are most negatively impacted? This platform can be used for diabetes, hypertension, some of those unique health disparities that impacts certain populations. But more importantly, we want this platform to be the platform that really moves the needle and levels the playing ground when it comes to healthcare and equality for all. So this is the first step, but it's a very promising first step.
Morehouse is not alone in trying to address this challenge of health disparities within COVID-19. We're working with clients across the healthcare continuum, including the federal government, state and local governments, healthcare provider clients, retail clients, on their own initiatives and strategies in trying to address this problem. They see the power in what Morehouse is trying to do. We're working with them to think through how they can either interface with the Morehouse strategy or adopt and adapt portions of it into their own initiatives. It's really exciting work, and we're proud to be a part of it.
That is amazing work, and thank you again, Morehouse School of Medicine, for all that you're doing to contribute to the well-being of historic Westside residents and residents throughout Atlanta in general. And again, you saw them mention the telehealth services. I also want to point out that Good Samaritan Health Center also offers telehealth services for people who might not be able to have in-person visits or for whatever reason would be better served virtually versus in person. So we have resources within our community. Be sure to take advantage. They're here to serve you. They're here to serve all of us and make sure that we all come out of this pandemic more resilient and better than ever. That being said, Doctor, I want to get back to breakthrough infections and the Delta variant. So with breakthrough infections, are most of them typically Delta variant? How severe are they, or are they, some other form of COVID-19?
Well, because right now, 98% of the variants rolling around this country are Delta variant that we are detecting. It's likely that if somebody has a breakthrough infection, it is due to Delta variant. As time moves forward, that may change depending again on which variant is the predominant one circulating in the community.
Got you. And, if I can still, a lot of people would question, if I could still get infected with Delta variant after I'm fully vaccinated, again, why even bother? And so I want to just reemphasize, more points about how getting vaccinated not just contributes to your health, but public health in general, because again, it's not just your health that we're concerned about, it's about you being able to transmit the virus to other people. So if you could just speak a bit to that.
So let me just say, it does affect your individual health as well. I'm going to get my booster so I don't end up in the hospital and take up a bed if I get exposed or contract COVID-19. I know that by having vaccination and a good antibody level, I am likely not to die from a Delta variant infection or the other variant that might be circulating in the community. I know that I'm not going to get that sick that I can't be the parent that I want to be for my kids at home. But also, the other reason I take the vaccination is because of the people in my immediate household who have risk factors. I have a husband who suffered a massive heart attack. His heart is compromised. And so I do not want to put him at risk by coming home, maybe asymptomatically harboring a Delta variant in my nostril, and exposing him. I am a pediatrician. I just mentioned earlier that 22% of our US population are children, and only those who are over 12 and up are even eligible to take the vaccination. So we have a whole bunch of infants, toddlers, young children who are susceptible. And that is why a year ago, we weren't hearing about the children getting infected, and we thought that they wouldn't be infected or mildly infected. That's not the case anymore, because we have more of the adult population that's been vaccinated. So it's leaving it up to our children that are on the front line being vulnerable. So for your community, for all the people who are vulnerable who haven't been vaccinated, for the people who are immune suppressed and not able to mount good antibody response, we should take the vaccine so our risk to transmit to them is reduced.
And you mentioned children being among the most vulnerable. Would you be surprised, or do you know of anything that's in the works as far as combating COVID-19 for children specifically?
Yes. So as mentioned earlier, Morehouse School of Medicine is part of the U.S. COVID Prevention Network. That is a network of many academic, other institutions that are working together to be a site to enroll volunteer participants in our vaccine clinical trials. And in those trials, we are well underway getting pediatric patients, volunteers in our trials. In fact, there are trials enrolling infants as young as 6 months into these trials. So if you look at the history of vaccine trials in general, outside of COVID, that's how it works. We look at healthy adults first, then we look at populations that are maybe at risk for that infection to be enrolled as volunteers, and then we kind of gradually, in stepwise manner, move down the age pattern. So we start with our adolescent group, and then we work to the 12 and up, and now it's 5 and 11, and so on and so forth, until we can get everybody who is susceptible to that germ vaccinated.
And I want to also hint at another point, because it's Morehouse School of Medicine that is participating in these clinical trials, correct? And, for a lot of people, the concern is often about, race and the history of, the abuse of vaccines and things that were, promoted as vaccines that were used specifically on African Americans and other people. So it's not like the phobia is just something that's made up in people's head. There's actual, factual, historical things that have occurred that have led people to draw these conclusions. So I want to speak to the importance of having an institution like Morehouse School of Medicine, which, anybody that knows Morehouse School of Medicine knows that it is very inclusive. It is full of, people of color and people from various backgrounds who are contributing not only on the, expert side, but we're also working to include people in the clinical trial so that the data is reflecting of not just one particular population, but a variety of people. So if you could just speak to that.
Yes. So we are one of 4 medical schools that are part of the U.S. COVID Prevention Network. And if you Google, you can find the statement, a joint statement put out by the presidents of these 4 HBCU medical schools, stating how we are adhering to the highest principle for integrity, transparency, and ethics along clinical research. We understand at Morehouse School of Medicine that we are a trusted source for the community, our own community here, but the larger community at the national level. And I'm so grateful to our president because she does a lot of advocacy work along health equity and brings attention to the fact that we are a trusted source and we have to maintain that by making sure we engage with the community and speak with them and address their concerns because we want to remain a trusted source. I'm humbled by the trial participants in our vaccine trial. We had over 60% African Americans in our trial. And they have come to me, volunteered. I didn't even ask them. They said, you know what? If there's any way or any time you need me to speak up on behalf of why I'm volunteering in this COVID-19 vaccine trial, I will do so. And I have taken them up on that. So, I can't emphasize the importance in terms of what our, not just our vaccine trial unit, but our institution, our biomedical researchers. There's so many facets of what our institution are conducting as far as addressing health equity, making sure we're transparent, making sure we're clear to the community that we serve about what it means to be a part of this vaccine trial or that vaccine trial.
And speaking about masks and the importance of wearing a mask, some people feel as if, well, if I wear a mask, why do I need to get vaccinated? I could just wear a mask and just ride this thing out until the end of the pandemic. What's the risk associated with that?
With wearing a mask?
With relying only on wearing a mask versus getting vaccinated and following through with wearing a mask.
Yes. So if you look at CDC's guidelines, and actually, as a pediatrician, I often look at what American Academy of Pediatrics has recommended because of the vulnerable population of our children. And it's doing this kind of layered protection. Layered protection involves masking, the social distancing, watching the ventilation of where you are, and the vaccination. The vaccination is the most key part because it's something that it just works for you without even thinking about it. I have antibodies inside me, no matter where I go, that's gonna be on alert in case I get exposed to COVID. This mask, it's not that convenient in some circles, okay? I can wear a KN95 all day if I have to, because I have to. But when I'm in my household, I like to be able to shut it, take it off. So the masking is one layer of protection. Depending on your risk situation, you may want to do more layers of protection. But fundamentally, vaccinations are the cornerstone because again, you don't have to worry about it. You just know it's working for you.
And as we work to wrap up here, I do want to tack on to the mask situation because again, you have some people relying solely on masks, which you just spoke to, but also the fact that the CDC guidelines for the masks have changed as the circumstances have continued to change over time. And that's also reflected in the policies that we see enacted throughout the city, state, so on and so forth. So with that, fluctuating over time, a lot of people just get fatigued as far as the entire thing. They just want to throw the whole thing out the window and say, to hell with it all. So if you could just speak to, how important it is for us to continue to follow the guidelines regardless of how they change, or if it would be more practical and more safe to just, follow a specific set of guidelines personally, regardless of how they might change, on the greater scale.
So let me just be clear right now. We are in a surge. It doesn't matter if you live in Georgia, North Dakota, New York, California. We're all seeing record high numbers of cases. I mean, it's amazing how bad it is out there. So mask mandates to me are an essential tool because many of us live in communities where very few of us are vaccinated, or we're not sure what percentage of the people are vaccinated. So to me, wearing this in public situations or unknown situations is the way to behave now. As far as going forward, I think it's about your risk tolerance. I think that you have to look at the community transmission levels that's happening. So if you live in a state or a county that has really low transmission rates, then maybe you'll feel more comfortable to take this mask off in the setting that you're in the public. But right now, no matter where you live, we're all in a surge. I mean, even the rural counties are really hit hard, urban counties are hit hard, and states. And if you look at the states that are doing the worst, it's the states that have the highest proportion of non-vaccinated folks. If you look at who's in the hospital, most of those are non-vaccinated folks. So really to drive the community transmission level down, it's going to help us in two ways. One, we can think about taking this off. Two, more importantly, we can really put an end to the variants and the aggressiveness of these variants. If you look at the grade of severity of the variants, there's a variance of interest, like we got to keep an eye on them. There's a variance of concern. Wow, we really got to keep a lid on this because they're highly transmissible. So the Delta variant is a variant of concern. Then we have the variants of high interest. Those are the variants that we won't know exactly what to do. We don't have any right now, but that's the way we want to keep it. So doing that layered protection in whatever setting, starting with vaccination, is really the key to keep us all safe.
Wow, and final question for you. You just hinted at it, but you know, again, Delta variant is a variant, one of several. The point being, COVID-19 continues to mutate. So, you know, the longer that people go unvaccinated, the more exposure that continues to circulate, the longer it sticks around as a pandemic, so on and so forth. The point there being that the Delta variant might not be the last variant that we have to worry about. So, you know, people are frustrated, people are tired of wearing masks and all of they're tired of the process, but it's important to keep it up because, again, this isn't necessarily the end of the pandemic, and it doesn't necessarily stop once we, you know, get through the Delta variant. There are possible risks beyond that. So if you could just sort of summarize one more time how the variants continue to pose risk over time and how we can help to mitigate that by once again getting vaccinated and following social guidelines.
Yes, so we're now, you know, coming up to year 2 of being in this global pandemic. And, you know, you and I both want to see the end of it. We want to be on the other side. We want to be able to travel freely. And I think it really takes a social responsible attitude to get us there. And I'm hoping that collectively, no matter where you live, no matter what age you are, that you think about that. We are all in this together. And to get out of it is that we all have to behave in our public forum, in our private forum, with mitigation, prevention foremost on our mind. And that starts with vaccinations. It truly does. We have 200 million folks in this country vaccinated. And I think that we're getting closer, but we have to all do our part, especially in those communities where you have high numbers of vulnerable populations, like the kids. So I hope, you know, that social responsibility sticks with all of us.
Indeed. And I just want to once again emphasize that, you know, bringing about an end to the pandemic is a team effort. You know, it's not just, you know, the people who have already been vaccinated continue to do whatever they do. But again, there's a reason why we're surging. And like any team effort, it takes people stepping up to the plate when you know, there's a realization that I can contribute more here. You know, and again, if your own personal health isn't your primary concern, if you're not concerned enough about that, then be concerned about, you know, your loved ones, the ones who you know who might have pre-existing conditions and so on, who are more susceptible to not just being hospitalized, but dying from COVID-19. So again, just if we all can just do our part, then we can finally one day bring about the end of this pandemic. That being said, Dr. Emmergluck, thank you so much for joining me. I appreciate you. Once again, shout out to Morehouse School of Medicine, Dr. Montgomery Rice. We appreciate you for inviting us to host today's summit in your facilities. And that being said, I want to bring up my lovely co-host as Dr. Emmergluck exits the stage, Ebony Ford. We're coming back to offer our gift card giveaways, I believe. Thank you again, Doc.
Thank you, Doctor. Thank you so much. That was such good information.
I mean,
my gosh.
Yeah, great information.
And I heard 3 things, and I'll try to make 3 points really quickly. For the people who are not vaccinated yet, think about who you're doing it for. Think about the people who cannot get vaccinated at all.
Right.
Our tender age children, the ones we care for and care about the most every single day, they cannot get vaccinated. So the only way we can stop the spread is to think about the people who cannot get the vaccine, get it for them.
Right. And you have a young son who,
Yes.
I don't think he's of age yet.
He's not, he's 6.
Right.
So he's not even close. Like, I have a nephew who's 11, he's turning 12 in October.
Right.
So, he could go get it then, but my son is not even in range.
Right.
So you have to think about who you're getting vaccinated for. And also, people are weighing the vaccine against getting sick right now, but you and Dr. Emmergluck made a very good point. That's not weighing it correctly, because if you get sick decades down the road, weigh that against a vaccine.
Right.
And I think you will come out with the conclusion that the vaccine is the way to go.
Absolutely.
And then also, we're in this together right now.
We'll get out of it.
We're going to get out of it
That's the
together.
only way.
So that's my 3 points. It was a lot of information, but I kept those 3 in mind.
Well, the good news is you can catch the playback on Facebook and YouTube anytime if you want to go back and rewatch anything that Dr. Emmergluck had to say. The information is posted on our social channels. You can access it whenever.
Absolutely.
That being said, Ms. Ebony,
Yes.
I believe we got some gift cards.
I do have the gift card giveaway. Thank you so
right.
much for obliging me and letting me get that out. That was
Absolutely.
just awesome information. And I don't want to skim over this really quickly because sometimes I just kind of say Home Depot and Goodwill, North Georgia, but to really know what impact these 2 organizations have on the west side of Atlanta and also the entire city of Atlanta, which Benjamin mentioned a little bit earlier. The Home Depot Foundation has been a strong supporter of Westside Future Fund, and it has invested millions of dollars in the equitable revitalization of the West Side. And without further ado, the winner of the drawing today is Miss Jamita Orange. So she is the lucky recipient of a Home Depot gift card.
Congratulations.
Absolutely, Miss Orange, congratulations. And also Goodwill of North Georgia. Goodwill is building a new store and career center on Metropolitan Parkway, which is set to open sometime this fall. As they build a new site in the city of Atlanta, Goodwill's hope is to become part of the fabric of the community and become a catalyst for further transformation in the city. Goodwill's focus is not just on helping our community find work, but helping them to move from low-wage jobs to successful careers. And through Goodwill Career Centers, our community will have free access to job search resources like computers, resume writing tools, job listings, employment seminars, software training, and more. And they're also giving something away today as well. That gift card is going to go to Miss Mordina Sullen.
All right,
Congratulations to those 2 ladies.
Absolutely. Yeah, and I got a chance to visit the construction site for the new Goodwill of North Georgia Center off of Metropolitan. It's going to be huge.
Yes.
It's going to be huge, and they're going to have enough room to service literally thousands of residents in the area, contributing to job placement, job readiness, education and training, and so forth. So shout out again to Home Depot Foundation and Goodwill of North Georgia. Thank you.
Absolutely.
Thank you for everything that you're doing to contribute to the revitalization effort happening on the west side, and everything that you're doing to just uplift and empower all of our residents throughout the city of Atlanta.
Absolutely.
We appreciate you. And I want to open it up to you again, Ebony, if you have any final thoughts for today.
Well, I guess I couldn't help get them off my mind a little bit earlier, huh? So I guess speaking to what I said a few minutes ago, we're in this and entering the 2nd year, as Dr. Emmergluck said, and there is no way out of this but together. There is absolutely no way out. And I spoke to someone today who was not a part of the huge wave, the people that went and got the vaccination at first, but they got one a couple of weeks ago. So I kind of had some doubts that maybe the people who didn't run out and get it, in the beginning, maybe the outreach wasn't reaching people. But I have found out that it actually is. So there still is hope. There still is time for people who have not gotten vaccinated yet. It's still out there. And you know what? It's even easier and quicker to do at this point.
Yeah, it is.
So I went to the Mercedes-Benz Stadium personally, and it was a lot of people. It appeared to be a lot, but it was quick and it was awesome. But it is even quicker and easier now. So there's still hope. We're in it together. We're going to get out of it together.
And I also want to point out that, there are several locations where you can go to get tested, rapid tested, as a matter of fact, where you can actually get your results same day.
Yes.
Again, Good Samaritan Health Center is one of those locations.
Awesome.
You literally can go up, get a test, and not even an hour later, you'll have your results.
Yep.
It's in a dashboard online that you can access, and you can show proof to other people who may require it, such as an employer or whoever. But there's also a center in the West End, I believe it's called Dragonfly. It's a tent that you can pull up to. It's a drive-through tent. And you can go and you can get a quick nose swab test. And again, within, an hour or so, they'll have that information with your results posted to, an account online where you can go and access it again to show proof of your negative test result and
Absolutely.
use it for however you need to use it,
come
for
to
doctor's
Morehouse School of
visits,
Medicine.
for whatever. Exactly. But that being said, we want to give a special thanks once again to Good Samaritan Health Center, Mr. John Allison, for that wonderful, wonderful devotion. Thank you again to Morehouse School of Medicine, Dr. Montgomery Rice. Thank you again for having us and your lovely facilities. Thank you again to Dr. Emmergluck for your time and all of your valuable information as the expert in the room. Thank you so much for everything that you just contributed to all of our well-being.
Yes.
And folks, we hope that you take this information, run with it. Again, the only way that we're going to see the end of this pandemic, regardless of how tired of it we are, it will not end until a lot more people do their part as far as getting vaccinated and following the social distance and mask wearing guidelines. That is how we cut back. That is how we end the pandemic. Pandemics don't care whether we're fatigued of them or not.
No.
Viruses don't care whether we're fatigued of them or not. We got to do the work. We got to do our part.
Absolutely.
That being said, we will be back on September 17th. We're going to be skipping September 3rd. We'll be back on September 17th. And we're looking forward to having Mr. John Nauman at that summit. Until then, y'all take care. We appreciate y'all.